Hello friends, let us now learn some important points about double contrast barium study. So, in a double contrast barium study, actually this technique of double contrast barium study is mainly started in Japan, where there is increased incidence of gastric malignancies. Gastric malignancies are more common in Japan. So as a result, this double contrast barium study is started in Japan. The main aim of this double contrast barium study is mass screening of gastric tumors. It is mass screening of gastric tumors for early detection. The double contrast barium study, the main aim is to screen the gastric tumors for early detection. This gastric tumors mass screening will require this mainly depends on more filming. We need lots of films, lots of x-rays for detection of this. Okay, this is mainly started for this, but now it is useful mainly for detecting mucosal lesions. In previously it was started to screen for gastric tumors, but now this double contrast barium study became useful for mucosal lesions. That is for mucosal lesions like for polyps or for any mucosal erosions. If there is any mucosal erosions or if there is any ulcers, we can do this double contrast barium study. For tumors we can do this, or for any post-op studies it has started being useful. We can use this mucosal lesions for polyps, mucosal erosions, ulcers, tumors and post-operative studies. Next, preparation. So in the preparation, now one important thing is dry fluid free stomach. The stomach should not have any fluid. It should be dry and it should have no fluid. So we need a dry fluid free stomach for doing this double contrast barium study. It should not be done, it is not done if there is any secretions in the stomach. If there are any secretions in the stomach, then we should not do this double contrast barium studies. Why? Because these secretions will prevent the mucosal coating. These will not cause good mucosal coating, and obviously if there is any defect, like for example if this is the bowel loop and if there are some secretions, think that there is a secretion here, okay? Because of this secretion, actually, the contrast will coat the mucosa but not the secretions. So these secretions will look as though there is some defect here. So we might diagnose the patient to have some tumor or to have some lesion over the areas where secretions are actually present. So as a result, this double contrast barium study is not done if the stomach has some secretions. Then, what is the contrast media used in double contrast barium study? In double contrast barium study, first and foremost, we use high density and low viscosity barium. We use high density and low viscosity barium sulfate is used. This high density barium is around 200 to 250% weight by volume. Okay, so because this is low density barium sulfate is used. Sorry, high density, low viscosity. High density, low viscosity barium sulfate is used. We should not use high viscosity barium sulfate. Why? Because if there is high viscosity is means the barium sulfate is thicker. Like water has low viscosity, oil has high viscosity than water. If you see jellies, all the jellies, all those will have higher viscosity than oil too. So If you see ghee, if you see for viscosities, better example is ghee has more viscosity than oil is more than water. That means water flows easily when compared to oil. Even oil also flows easily when compared to actual ghee, which is thickened ghee. So if you take this as example, so because of this high viscosity, this barium will not flow well. So if it does not flow well, it does not coat the mucosa well. So as a result, it will show some defects. Similarly, if this part of mucosa is not coated, like for example, if this is the bowel wall and here the barium is there, barium, because if it's high viscosity does not coat well, it does not flow well. So as a result, it does not coat the mucosa well. So this part which is not coated, this might be misdiagnosed to any tumors. So as a result, we should not use high viscosity barium sulfate. Always low viscosity barium sulfate should be used. Number one. Number two, in the barium sulfate which we prepare, this should not contain any bubbles, air bubbles. Why? Because it's simple. If the barium sulfate which you have prepared, okay, if this barium sulfate has any type of air bubbles, if there is a bubble here, similarly bubble. So these bubbles, the areas where bubbles are there, these might be misdiagnosed again as tumor. So as a result, you should make sure that the barium sulfate that you use should not have any air bubbles. So to prevent this air bubble formation, we use anti-foaming agents. Anti-foaming agents will inhibit the air bubble formation. This will inhibit the air bubble formation. So as a result, we use these anti-foaming agents. Okay, next. Next we have gas forming agents. Okay, first we have contrast media, which is nothing but we have used barium sulfate. We should also use some gas forming agents. These gas forming agents are actually sodium bicarbonate and citric acid. Sodium bicarbonate and citric acid, these are given to the stomach, to the patient, sorry, these are given to the patient orally. And once they are given to the patient orally, so citric acid, actually these are given orally. Okay, these are given orally. Once you give these orally, once they reach the stomach, in the stomach, these will produce carbon dioxide is produced from them. Okay, so this carbon dioxide is the one which acts as a negative contrast. Okay, so this carbon dioxide acts as a negative contrast. Right now, we also have some commercial powders which can be used for gas formation. We have some commercial powders like we have gastrovision or eno or fruit salt. Okay, all these will also cause rapid gas release, and thus these can also be used for these double contrast studies. Because they cause rapid gas release, they can be used for double contrast studies. Or sometimes you can also put a Ryle's tube in stomach. You can put or place a Ryle's tube in stomach, and then you can insert a Ryle's tube. It's better to say insert. You can insert a Ryle's tube in stomach, and through this Ryle's tube, that is, if this is the stomach, you have inserted a Ryle's tube. Okay, and through this Ryle's tube, you can give the air. Okay, so you can inject air with Ryle's tube also. Okay, so this is the second agent. So these are two agents. One, you use normal contrast media, and second, you use this gas forming agent. So we call it as double contrast study. Then along with that, we can also use some smooth muscle relaxants are also used for this double contrast studies. So smooth muscle relaxants, if you see, These are actually, one of it is hyoscine. Hyoscine is given intravenously, and this hyoscine will cause, number one, because it is a smooth muscle relaxant, it will relaxes the smooth muscles of the, it will relaxes smooth muscles of bowel, especially of stomach and bowel, and thus it will cause distension. Because it relaxes the smooth muscles of bowel and stomach, it will cause distension of stomach, and as a result, once the stomach gets distended, actually in the stomach, if you remember, there are many rugae which are nothing but the mucosal folds. Once the stomach gets distended a lot, these mucosal folds will get effaced, so that the whole wall of the stomach wall can be visualized completely. Because if there are these mucosal if there are these mucosal folds or rugae, there can be some smaller lesions which are actually uh, hidden inside the mucosal rugae. But right now, when the stomach is completely distended, then those smaller lesions will not be hidden. Next, we have Buscopan. Buscopan can be given as 1 ml, or 20 grams of Buscopan can also be given as intravenous route. This Buscopan is contraindicated in certain patients. The Buscopan is contraindicated in patients of glaucoma or urinary retention or tachycardia, cardiac diseases, or if the patient has poor general condition, or if the patient has any hemodynamic imbalance. So, hemodynamic imbalance. So, Buscopan is contraindicated in glaucoma, urinary retention, tachycardia, cardiac diseases, poor general conditions, and hemodynamic imbalance. So in the double contrast studies, we are using three things mainly: contrast media, gas forming agents, and smooth muscle relaxants. Now let us see the technique of double contrast study. So how are you going to actually do the double contrast study? So first and foremost, we will have to give IV Buscopan is given to the patient. Before we even give barium to study the stomach, we give IV Buscopan. Right. So, first you give IV Buscopan. Just before giving barium, you give IV Buscopan. Then after that, you give 100 to 150 ml of, obviously we are giving here high density and low viscosity of barium is given. High density, low viscosity barium is given. Followed by this, you give a gas forming agent. Okay, these are the three steps. We have three agents, we have three steps, obviously, in giving contrast. First, we give IV Buscopan. Followed by that, we give 100 to 150 ml of high density, low viscosity barium. Followed by this, we give a gas forming agent. After that, you will have to rotate the patient slowly. So first, from supine position, the patient is in supine position, and from the supine position, the patient is rotated to right lateral position. Right lateral position to the patient is rotated to uh, prone position. This is prone position. From that, again the patient is rotated to left lateral position, and again to supine position. So the patient is completely rotated slowly. This rotation of patient, this complete rotation of patient will mainly help in coating the mucosa of stomach. For coating the mucosa of stomach, this rotation of patient is very important. Then, once you have rotated the patient, now same as we have seen in single contrast studies, the standard views are taken. Okay, now we will have to take the standard views. Same as demonstrated in single contrast study. Now, what about the advantages? If you see the advantages of double contrast study, because we are using two contrasts like barium swallow and also barium meal, barium is also used and also we use here. So as a result, it has high accuracy. Okay, it has high accuracy mainly for certain things like it can be used, it can be done following gastric surgery. We can do it after any type of gastric surgery, or it is done after bile reflux gastritis. Then it is done if the patient has any marginal ulcerations, because these marginal ulcerations are not detected in single contrast study. So you can detect them better in double contrast study. If the patient has any recurrent carcinomas, or if the patient has any abnormalities of efferent loop, any recurrent carcinomas, or if the patient has any abnormalities in recurrent loop, so all these can be diagnosed by double contrast studies. Now, what are the disadvantages now? Disadvantages of double contrast studies. So, if you see the disadvantages, mainly include these double contrast study can also miss, just like single contrast study, it can also miss some polyps or ulcers or erosions can be missed. It can miss polyps, ulcers, erosions, or if there is any superficial carcinomas, can also be missed by double contrast studies. Right. Now, how will you diagnose these? Right. So, double contrast study misses polyps, ulcers, erosions, and superficial carcinomas. So, we cannot leave them like this. So, there is one more method, that is biphasic study. This biphasic study will help to overcome these missing things. So we will learn this biphasic study in our next class. Thank you.